welcome everyone. We have a great turnout, so thank you for everyone for joining. My name is Jaime Reyes Sanchez. I'm going to be one of the moderators of this great panel organized by the SNRN committee. So I'm currently a fourth year PhD student in epidemiology at the University of Southern California in Los Angeles. And my work is around heat-related mortality. So I will pass it on to my co-moderator, Teresa, and she will also give you a little more information on how the panel is going to work.
Thank you. So my name is Teresa. I'm a fourth year PhD candidate at NYU, and my work is around chemical mixtures and child neurodevelopment. Really excited to be with everyone today and for this panel. So for those of us who are joining, we'll have about 40 minutes of moderated Q&A, and then we'll have 10 minutes at the end of our session today where the audience can ask questions. And so if you have any questions throughout the panel, please put it in the chat, and then we'll try to get to some of those questions during the audience Q&A portion at the end. But we want to know a little bit more about our audience as well. And so for those who are in the audience, we'd love to know more about kind of the career paths that you all are exploring. We have lots of different answers coming in. A lot of folks from academia, but also we have folks interested in industry, nonprofit, and government. So that's great. There should be something here for everyone then. Awesome.
So most people have answered the poll. Let me see if we can now share the results. I think we are showing here the results. So yeah, we wanted to know what people are thinking about their most likely career path. So it seems academia is leading the answers, followed by nonprofit, government, and then industry at the end. So we have some of everything. That's great. So I'm gonna now stop sharing the results. And with this, we're going to introduce our great panelists. So I'm going to start with Grete Wilt. So Grete is a Senior Director of Consumer and Growth Analytics at United Healthcare Community and State. She completed her PhD in Environmental Epidemiology at Harvard University and a Master of Public Health degree at Emory University.
I'll be introducing Dr. Nicolas Borchers-Arriagada, who is a postdoctoral research fellow with a background in industrial and environmental engineering, environment, and health sciences. Nicolas has developed a career as a multidisciplinary data scientist whose work intersects modeling, public health, health economics, bushfire management, and more broadly, the risks of climate-related and extreme weather events. Welcome.
And as our third panelist, we have Samuel Osorio. He's a Colombian physician, doctor in environmental health sciences with more than 10 years of experience in local and international environmental health research, epidemiological surveillance, and policies. He's an international consultant in environmental epidemiology for the Pan American Health Organization, and he has also recently provided international consultancy for the World Bank in Colombia, Peru, and globally. So with this great panel, we will now get started with our moderated discussion.
Awesome. So our first question is we just want to know more about you all and the journey that you guys have been on to get to this point. So if you all wouldn't mind just taking a moment to tell us a little about your journey to where you are at now, and anything that you would have changed or done differently to get where you are. So maybe we'll start with Grete first.
Yes. Hi, I'm Grete. So prior to starting my PhD, I was at the Centers for Disease Control and Prevention, working as a spatial statistician on a myriad of projects, doing a lot of index development with the Social Vulnerability Index, with the Geospatial Research Analysis and Services Program. During that time period, I decided to go back and get my PhD, and I remained working about part-time for the CDC during my PhD. I would say during my third year of my PhD, I was really open to exploring all options after I graduated, and I was approached at a career fair by a recruiter in the Medicaid division of United Healthcare, and they were very interested in, I'd say, the research background and public health background and the skill set that it could bring to industry. My first reaction was like, I've never seen myself working for a private industry. I'd always anticipated actually going back to the government. But I was open, and I did a 10-week internship during the summers between my third and fourth year, all while still applying to other jobs. And I think that's really important, having a lot of opportunities, never, I think, fully making a decision. I'm always about like exploring every option. And so in my fourth year, I ended up having some consulting offers, some postdoc offers, this position at United, as well as the Epidemic Intelligence Service, and I ended up taking this job. I was really excited about the opportunity to manage a team. So I have a team of 4 data scientists that report to me. I do a lot of survey development and design, and competitive analytics and research in the Medicaid space. And I think I find ways to use my degree in every day, even though I'm definitely not still in the field. I think I'm still really open to returning to government, but we'll just kind of see where it goes. And hopefully that's enough. I think like in my spare time, I love to read. I love to spend time outside, biking and hiking. And location was really important for me in my career choice. I work remote with travel for work, and having that flexibility was really life-changing.
Awesome. Awesome. Thank you. Nicolas, would you like to tell us a little bit more about your journey and anything you might have changed along the way?
Yes. Thank you, Teresa. Well, so I live in Tasmania at the moment. I don't know if anyone knows about this. It's a small island in the south of Australia. It's part of Australia. I moved here about 8 years ago with my wife then and my daughter to do a PhD on the health burden of bushfire smoke in Australia. Before that, I wasn't doing any research. When I finished uni as an industrial engineer, I worked as a consultant mainly, looking at different projects, assessing the impacts of air pollution on health and doing cost-benefit analysis of interventions to reduce air pollution in Chile. Maybe I forgot to say I'm from Chile. And I worked also as a data scientist analyst at the Environmental Enforcement Agency. So there was throughout maybe 10 years or 12 years, I acquired some I don't know, techniques or tools that would help me throughout my career path now. Working with different projects on different topics and a lot of data wrangling, environment, health, and everything. And then we had these huge fires in Chile, if I recall, okay, I think it was 2017 in the south of Chile. And I was working in the CBD, in the center of Santiago, for the Environmental Enforcement Agency. And we had probably 2 or 3 days where it was covered completely with smoke during summer, which is very rare. In summer, Santiago, for those of you that have been there, it's a very polluted city, but mainly during winter. And summers are really nice and clean. Yeah, there's a lot of ventilation, but this was really strange. And then I thought, oh my God, this is terrible. And I started looking online for what happens with wildfire smoke and health and things like that. And I bumped into a professor, Faye Johnston, here at the University of Tasmania. And she was doing this incredible research on wildfire smoke. And I had previously traveled through Tasmania for 3 months before my daughter was born. So I said, oh, that's great. It could be a good opportunity to do like a career change. I'm always looking for a bit of a career change. So maybe it's the generation, I don't know. So I contacted her, and like the next day I was having a chat with her and someone in Canada. I was in Santiago, and we were like putting together this project for me to apply for a PhD position. And in a matter of maybe 2-3 months, I got the scholarship, moved to Tasmania, and now I'm here. Although I am working as a postdoctoral researcher, I feel that, well, there are 2 things. One, I had these previous 10 years working as a consultant that did help me throughout my PhD. I think that I took it as a job. No, for me, I would go to work. I had, I don't know, 5 projects to do. I would just do them. And then I had to go back home because I had a daughter and a wife, and it was like work. So that was pretty good. But also at the same time, I feel like I have 1 foot in academia and 1 foot outside because I still do consulting. So like Samuel, about 2 or 3 years ago, I started doing a bit of consulting with the World Bank on things related to bushfires and health in Latin America. And I love it. I just love doing new projects all the time. And it just, I don't know, maybe I'm a bit like addicted to this new things all the time. And at the same time, yeah, I don't know if I am so comfortable following a purely academic career path. Sorry. So yeah, I think so. Nowadays, I'm doing a fellowship, but always looking for other options out there. Yeah.
Awesome. Thank you. And then Samuel, you can tell us a little bit about your journey to your position.
No, thank you. Thank you. It's great to hear Grete and Nicolas' experiences. And I think I can relate a lot with mainly with Nicolas' experience. I'm from Colombia, so from Bogotá. So I was really curious. I was a research monitor when I was studying medicine. At that moment, it was in anthropologic medicine. So, but I was also really curious about environmental health. But in Bogota, we didn't have a lot of options for research. So when I wanted to do research, when I entered medicine, um, I I began to work with the health secretary of Bogota for a couple of years in a project about heavy metals, mercury and lead, and building a surveillance system for Bogota. So it was kind of a very policy applied research, and I wasn't in the academia properly, but more in the health secretary of Bogota. I worked there a couple of years because I wanted to finish that project, and then I did my a master's in public health in the University of Sao Paulo at Brazil. I was really curious about not just the research groups from Brazil, but also their culture So for me, the master's was what researching, but was also about the place where I was living. So for my master's, I researched about temperature and mortality because I wanted, or I thought that it was like at the moment the future, and I think in the coming years it has become a reality. But when I came back to Colombia, it was they weren't working with that yet. So I worked again at the health secretary again with air pollution, um, and especially with air quality indexes. So I worked for 4 years, a couple of years also as a professor in a medicine faculty there in Bogota, but also in the health ministry and the Health Institute of Colombia. And then I decided to go to Mexico for my PhD, as I already knew or meet my supervisor Horacio Rojas, and I thought it was really interesting to go deeper in with the health air quality indexes. So I decided to do my PhD about that in Mexico. And it was really a great experience because with Horacio we could work developing the air quality indexes for Mexico. And I could be in the negotiations between the government, academia, NGOs, but also for Bogota with my ties with Bogota. We helped develop their air quality index. And as it is, Horacio has this collaboration center with PAHO. We worked for PAHO also. We designed another air quality index for Peru, and we designed a document like a guideline to build air quality and health surveillance systems for Latin American countries. So it was really interesting, and we had the opportunity, or I had the opportunity to interact with PAHO. Um, and so then, last year that I finished my PhD, I began to work with PAHO as an international consultant, mainly with air pollution, but also climate change. Yeah, and what we do there is mainly what I do is helping to assess the impact, as Nicolas also said, for the countries in Latin America, the impact of air pollution and other environmental exposures. Mm, and also just to mention, yeah, I in the process, I also had this consultancy with the World Bank about um, we calculated the burden of disease for temperature for Colombia, and it was really interesting for me because all the time was like applying this that I did in my master's, or what I did with other research groups, applied and to give like a document to the government, so or some elements to build public policy. Thank you.
That's awesome. I feel like that's a great example of sort of translating your experience, during your master's in research into kind of real world impact, which sort of brings us to our next question, which is sort of what would you all say is the main impact that you make through your professional activity in your position? So maybe this time we'll start off with Nicolas.
Thank you, and great, everyone. So I feel, yes, one of the things I like about doing the type of research that we do in health burden assessments and things like that, and consultancy, is that at least there is a sense that whatever we're doing easily translates into policy or something. And I work with a professor here that's a great advocate on improving things, at least in Australia. So whatever we do, gets on the news and there's an interview, and we develop tools that are used to negotiate improvements. So that is really satisfying, I think. Yeah, well, we work with public health, so I think that everything we do has a little bit of impact. So that's really good. And from here, I'm also trying to do some collaborations with, for example, the thing with the World Bank. And now I'm collaborating with the Lancet regional report in the Americas. So trying to have an impact in my region from far away. I think that's a bit satisfying too.
Great. Greta?
Yeah, so I think my previous experience had been right in nonprofit, and then in government, and then in academia. And I remember my recruiter trying to get me into industry was like, you'll be surprised at how quick things can happen here, and just come try it for a few years. So one of my mentors, who was also previously at CDC and Harvard, and now is at United with me, counseled me on some of that, of just, you can make an impact in a larger industry. And so some things that I think about is one large project we operated was, we had all of our public health emergency individuals who were paused from renewing their Medicaid from 2020 to 2023 during the COVID pandemic, all had to renew their Medicaid this past year. And so we had to do a ton of data analysis and research on what are the best ways to communicate with those individuals, checking data from the state, et cetera. I think we made a big impact and retained 70% of our members, which was much more than, I would say, like the average benchmark. Additionally, it's pretty fun to be able to, I think, conduct research so quickly and then see it translated into direct action, which, Nicolas, I think you've said. We've done research on access to care, as well as health risk indices, and built these out. And it's led to expansion of our network, which has led to, improvements in member experience. We've done work to suggest, right, that there's issues with getting access to internet or groceries, et cetera. And then we carve those in as additional benefits and provide it to our members. And so I've really enjoyed this like incredibly tangible way to say, okay, I want to improve this. One thing I'm working on right now is research with our dental networks to basically be able to say, look at this, how do we make sure that we have more dentists able to provide care, or how do we incorporate this as a benefit? So it's definitely not environmental health as focused, though some fun work I've been doing lately has been on disaster resiliency and providing the data to basically identify areas where United wants to invest more money or funding into some of the community projects, et cetera. So I think there are ways in which we can have more control over the industry than we think. And that's been, I would say, satisfying to me.
Great, thank you. Samuel, same question for you.
Thank you. For me, the main impact that I think I make with these professional activities help governments and decision makers to make decisions, to give information or products to know what are the more sensible or vulnerable populations, or what are the states or municipalities most affected, for example, by temperature, and where to prioritize these interventions. so I think it's has most of the impact. But also it's really interesting because sometimes you produce really good documents, but they couldn't. So a lot of times happens that they are not used by the governments, you know. So it's also good to work when having strategies to have those documents or products well received or you know articulated with the action also. So when happens in that way, it's so much better and the impact is bigger. Because just for example, when we produced the air quality index for Peru, they didn't use it, and yes, it wasn't the idea, but with the burden of the sea of temperature, we had a strategy so it could be better received by the decision makers. But also, what happens with air quality indexes is that you can see that not just the decision makers use them, but also NGOs, academia, and also people to know or to better understand the message of what's happening, you know, with air pollution. As understanding air pollutants is really hard uh, for uh, for academia people like us, but for general people is really hard. So uh, it's an instrument for them to know the impact on their health. So I think it's a good impact that's made there. Over. Thank you.
Great. Thank you. So I guess, you know, along with impact, we are curious more about like what the most rewarding aspect of your career is and sort of the thing that keeps you coming back every day. So we'll start off with Greta.
Yeah, I would say the most rewarding part of my career is the mentorship that I get to provide to my team. I feel like I've had good bosses, I've had bad bosses, and I was very interested in mentorship and how to support people. I also think there's a huge gap, whether it's academia, industry, government, nonprofit, of the people who truly do the work presenting and communicating the results and how to communicate effectively. And so watching them grow, being able to secure promotions for them, etc., has just been like incredibly rewarding. And I think building a team that works so well together is just the best part of my day. I have a fantastic group of people that I work with.
Great. That's awesome. Samuel, if you'd like to tell us a little bit about the most rewarding aspect of.
Okay. No, in fact, I was trying to make a difference between this question and the last one because you know, like seeing the impact through the professional activity is, I think, is really rewarding. You know, to see that you will have some impact. For example, when we saw that the air quality indexes in Mexico and Bogota were published with their respective laws, or you know, like that it was a reality. Um, so it was really rewarding. I think that also, as Nicolas was saying, I also work with one foot on the academia and another on the consulting. So I think that sometimes you get the best of the both worlds, you know, all the interaction and the high academic level and discussions, but on the other side, on the consultancy, um, using that, you know, that it's not going just to a paper, you know, and get published in a good journal, but also that it's used. Is I think that's really rewarding, and you could use things from both worlds. And in Latin America in general, academia or research paths, they are not as well rewarded in payment as a consultancy. So having consultancies, it's like be feeling more rewarded in what you receive as a payment
Totally.
over.
So important to feel like truly compensated for your work. Yeah.
Yes.
Nicolas, just we'll end this part on you.
Okay, so just short. Yeah, likewise, I think that in my case, it relates a lot to the previous question. So I think there are mainly two things. One is I do feel that I'm making an impact with my research. And that's great for public health and everything, but also I think about my daughter. She's 10, and I don't know the world that waits for her in, let's say, 20, 30 years. So at least I feel, okay, I'm contributing a little bit to her future. And also I'm a bit of a data geek. So I'm doing what I want. I really like my work doing different projects, looking at spatial, a lot of data and seeing how we can disentangle that into something that's useful for society. So it's both things probably. I'm doing what I want, what I like, and I'm having an impact. So that's really good.
That's great. Thank you.
Great, thank you, everyone. We're continuing with these moderated questions, and we have so far focused mostly on positive aspects of your activities. But now I want to extract maybe negative or at least challenging aspects. So what would you say are the most challenging aspects of the careers you're pursuing, and maybe thinking about people that are considering pursuing these career paths? What do you want them to know in advance, or what did you maybe wanted to know in advance of pursuing these paths? So maybe Samuel, we can start with you.
Okay, yes, no, that's a really great question. I think for me, one of the most challenging aspects is, for example, the work environment, both in academia and both in consultancy or working with the government. That changes everything, you know, because your relation with your director or your boss, and for me, it's really sometimes it's hard to read, you know, the environments. So sometimes you don't know something that you have to behave in some way or taking care in another way, and so that could be problematic. So I think it's really hard to know about that before working in or in the academia or in the government in any place. It's hard to work to know that, but that's one of the most challenging aspects. And yes, if you could receive in any way some advice in advance, it would be really great. And other thing is that I don't know, you hear all the time in the academia, more in the academia, but also working in the work environment for government or consultancies, that you have to take care of your mental health. But I think it's not enough, you know. I think it's for me, if I would receive before more advice or how to take care of my mental health, also in the work environments, but also in the academic environments, um, it will have been I will have taken better decisions, and yes, and so I think it's a key aspect that it will be nice to have advice. Thank you.
Thank you very much for sharing that. Nicolas, do you want to go next?
Sure, thanks. Oh, I can think of a couple of things that are a bit of challenging. One of them was I did my PhD at an older stage. Probably I started when I was 35, which I said before, it was easier because for me it was work. No, I had all this experience and I brought this to my PhD, so I made it very sort of easier. But at the same time, I was managing family life. So probably I wasn't willing to sacrifice as much as I might have maybe 10 years earlier, when I was 28 or 27 or something. And even now, so my daughter is 10, so I think that I try to limit a lot how much I work and the things I commit to, because I just can't. I might have to wait until maybe she starts university, or I don't know. And another part is that I've noticed that I'm a bit of an introvert. Probably a lot of people that dedicate themselves to research are introverts. But developing an academic career also requires you to do things that put you out there. I don't know, going to conferences and networking and creating groups, projects, applying for things that for me are a bit challenging. No? Mainly networking and developing projects. That part is, I struggle a bit with that.
Thank you very much for sharing. So now, Greta, what would you say are challenging aspects of your specific activity, or in general industry?
Yeah, so a challenge for me is definitely being, I think, a public health researcher first and foremost, going into an industry where many of my coworkers work for the private health sector. Was not sure that was something that was right for me. And I think daily I have to keep myself in check and question if my being there is useful to, expand Medicaid and improve individuals' access to healthcare, or it perpetuates further harm. And so that is something I think about on a daily basis. Never had more meetings in my life. I think I thought I knew what a busy schedule is, but I think I routinely have like 12 meetings a day. And you're expected to work on top of that and produce things. It was definitely a transition to be from someone who so badly wanted to show, here are all the advanced methods I'm applying into this thinking, and making sure to communicate results first. So I've really adapted and changed how I communicate, which I think is good training just like in the broader public, but that was hard at first. Like, I don't think we as scientists get mass communications training and how do you sway people to understand your research quickly. And then something that I think I did really well going into this job, but in my previous jobs, I think has been something I wished I knew more, was pay transparency. Obviously, different fields, you're going to have way different pay scales. Tell people what you make, talk about additional compensation like bonuses. I think that's such a way that people are taken advantage of, especially coming from more of a academic or a research space, and it's not openly communicated. And so I'm always happy to disclose. And I just think that's like really important when going in and negotiating a job after your PhD.
Thank you everyone for sharing these more challenging aspect of your activities. And thank you, Greta, for adding one more meeting to your day today. And so now, I guess this next question is a little bit wide, but so I want to ask you what has helped you get to where you are. But maybe we can try to make it a little bit concrete. What specific advice or a couple of pieces of advice would you want to share with people that are considering going into one of these career paths? What do you think would be very important to mention? So maybe we can start with you, Greta.
Yeah, I think use your networks. Also for, I think, a non-traditional, so non-postdoc, you want to be looking the summer of your third year. So that means you want to be looking in the fall and spring of your third year. That is early, and I think that stresses people out. The career centers at your universities are fantastic. That is why they are there, to help you. I had a career advisor rewrite my whole resume. That would be, I guess, my other piece of advice would be a resume, not a CV. Now that I've done hiring for an industry, we post a role for 24 hours and we get 300 applicants. And so being able to distill your work down into a page or two has to be sufficient. And that was confusing for me coming over and having a CV, but really working with those experts. You know, they are trained in that. They know how to make your resume stand out. Use them.
Thank you very much. Nicolas, do you want to go next?
Yep, thank you. So a few things I would think. One, hard work. I think it is hard work. Like you have to do the job and be able to back it up with results. That has helped me a lot. Also, like I was saying before, doing something that I really like, that I'm passionate for. I think that in any job, probably that gives you that extra drive that you have that you need during the hard times. And also, I've been very lucky to have mentors or bosses that champion for me. So they advocate for me, for my work. They connect me to broader networks, and they don't want to retain me. Like they're just, so if you can find someone that can champion for you, that would be great.
Thank you. And Samuel?
Yes, I think that something that helped me is like having or trying to develop a kind of sight or vision to know what governments or multilaterals are struggling with in terms of public policies or development. You know, what knowledge and areas they need to develop. So in that way, when you can see that, you can also get more focused on how you build your skills or decide your research paths. So in that way, when you acquire those skills, you know, you are certain or almost certain that those skills of you are going to be useful, you know, and are going to have demand. Mm, so that yes, that's like not to be like this isolated view from the academy, but also yes, trying to know what is needed in the decision makers environment. And also, I would say collaborate a lot, you know, go and show your results in academic and non-academic congresses or meetings, build networks, you know, and don't be afraid to present yourself in a really brief manner. I don't know, 30 seconds, and to show or to mention your skills and your achievements, and when you collaborate also have something to offer or propose, not just to ask. So so yes, I will say that is useful.
Thank you very much. So I think we have time for one more moderated question, and to the audience, feel free to drop the questions you have that haven't been answered in the chat. Maybe we can also let people directly ask a question with the microphone, but if you prefer, you can also drop them in the chat. And we will go to that to this section next. But the last question I want to ask to the panel is, how would you say is your work-life balance? Maybe in your specific situation, but also maybe in how would you say work-life balance is in the area that you work? Samuel, do you want to start?
Yes, thank you. Working with multilaterals has some things really nice. For example, that you can decide where you live, because yes, as you work remotely, or at least as a consultant, you can decide where you live. And I think it fits in the work-life balance. Yes, because, for example, I'm from Colombia, but if my family or I want to be in another country, so that's really, really helpful to decide where to live. So that fits. And other thing that they don't fit so easily is that as a consultant, you don't have like this 8 or 9 a.m. to 5 p.m. Schedule strictly. You have to give results. So sometimes you have to work, I don't know, to get a little bit earlier or work overnight. But yes, for people or for people that come from the academy, that's usual also, I think. So so yes, but the fact of working in different places, I think it fits with that way of life. Thank you.
Thank you. Greta?
Yeah, I think I have set really good work-life boundaries in any career. I think, right, it's can be easier or more difficult, and it's really on you. I work East Coast hours on West Coast time, so I'm up early, but I'm done working by 3 or 3:30, which would be like 6:30 Eastern, which is, I think, very nice. And I think what I prefer from it is I feel like I log into work, and I agree with Nicolas' comment of like treating a PhD or however you can treat any of your jobs like a 9 to 5 as much as possible, and just setting those boundaries. So you can always work more, but I think I have a pretty good work-life balance.
Thank you. And at last, Nicolas.
So I'm not sure if I have a really good balance. I don't think I work a lot of hours, probably maybe, let's say 40 hours a week or something, but they are spread out throughout the week. So some weeks I start at 7 to 3, but also if something happens with my daughter's school or something, it doesn't matter. I can leave work at 1 and then work a couple of hours in the afternoon, because I do consulting for the World Bank. That means that once or twice a week, I wake up at 5 a.m. and have my meetings in the morning from Australia. Sometimes I take a day off and I can make it up during a Saturday or something. So at least that's how I've worked always, really. Having that flexibility. So it has like it's like a two faces of the same coin. I have a lot of flexibility, but it also means that sometimes I do have to sacrifice a little bit of my time to compensate. But I'm happy with that. And honestly, yeah.
Thank you. Thank you, everyone. So now we are transitioning to the Q&A from the audience. So we already have a couple of questions, and as I said, we can also try, maybe you can raise your Zoom hand and and we can let you directly speak if you want to share your question. And I also just shared again the same poll that we did at the beginning. So I guess the objective of doing it again is to see if there is any change in the career paths that people are considering, which could be causally attributed to this great participation that we have had from the panelists. So, okay, and we're already getting more questions from the chat. So I'm just going to end the poll now and show it. So I guess the results are similar. But yeah, we would have to consider all the potential biases that we always think about in epidemiology. So with that, let's transition to the Q&A. And so one question we have here from Hannah Lee is if you could comment a little bit more on how sometimes in industry there could be a conflict between profit and public health. So I guess this is directed to Greta, but maybe Samuel, Nicolas, if you feel maybe in consulting or something else, there could be this tension, feel free to also participate.
Yeah, happy to take a stab at this. I think it's really important to go in and always question. I also think, at least in the United States, the current state of the matter is like we are so far from making a universal healthcare system that I was really interested in digging under the hood and saying, okay, well, what would it look like to get there? Would we ever expand the government enough to run it fully through the government, or more likely it would be run through these managed care organizations? One of my mentors told me, if you want something like Medicaid or Medicare for all, come work here and learn what it would look like to expand. I think like one of the most rewarding opportunities is we had expansion in North Carolina, and to see the amount of members that now were individuals who had healthcare, and to see the impact that you can make was really powerful. I think one thing I hold myself to is, I'm given United Healthcare stock. That is something I feel like fairly morally in conflict about, because the better that company does, the more money I make. And trying to always distance or question that. Do I want that stock to perform well, et cetera? I don't have all of the answers. One thing I will say is I've met many like-minded public health individuals who work in the private side. I also think the unfortunate state of affairs right now is the government is being gutted. A lot of academic opportunities are being gutted. And there, I think, is good work you can do in the private sector. I just think keeping your wits about you on your morals. I have certain lines that I know personally in my organization I will not cross. Like, I will not go work in the private sector. I will stay in the Medicaid space. And if that hinders my promotion in the company, that's something I'm fine with.
Thank you very much. So in the interest of participation from the panelists, I will now mention one question in the chat, which seems more directed to consulting. And the question is from Kimberly Parra. How did you find your first consulting opportunities? What platforms or strategies have been most effective for you? So I guess this is more directed for Nicolas and Samuel, but also feel free to mention anything about the previous question if you want to.
Okay, so for me, I didn't look at any platform, for the consultants that I've made because indeed in the network that I built, people for example, the consultancy with the World Bank, people from the Colombian government, they already knew my work. So when the World Bank was looking for someone to some climate change and health analysis, they recommend me. So and I think it's a way that for me has worked, and something similar happened with Pajo. I had already made some consultancy works with my uh, with my supervisor, PhD supervisor for Pajo. So they already knew my work, and then they offered me like directly a consultancy. So yes, for me it has been that way, but also I have been offered consulting works or positions using LinkedIn. So I think building a good LinkedIn profile and network is also really useful.
Thank you. Nicolas, do you want to share your experience with this?
It's a bit similar and a bit frustrating actually. I think I've applied to so many interesting consulting offers and nothing. Everything I've gotten has been through someone I know. I've worked with prior before or met in some business conference or research conference. Everything has been through someone that knows how I work and my work. And saying yes, sometimes they offer you things. I think that has been really good. They offer you they had offered me something, for example, and I just jump in there and say yes without actually thinking, okay, how much time and everything. But that sacrifice leads to other things. Yeah.
That's great. Great advice. So we are at the end of our EPILOG webinar series or session on exploring academic and non-academic career paths. On behalf of the Student and New Researchers Network at ISEE, I want to thank our incredible panelists for sharing their experiences and insights. I know I'll be thinking a lot about everything that you all said today. I'd like to thank the audience as well. And please stay connected with the ICE SNRN. Be sure to follow updates and look out for future EPILOG webinars. Thank you all again for joining. And if it's possible for the panelists to just stay on for a little bit so we could get a quick photo of everyone for this series.
Yeah,
Hi.
sorry to those,
Oh, go ahead.
that shared some questions and we couldn't answer them. And also thanks to the organizers, Maria Luisa and Chinonso from SNRN.